My name is Peter. I'm a family nurse practitioner and I'm a medical provider in the Foreign Service. Well, I was born and raised in Carmel, California, beautiful place. My parents were both immigrants, so I kind of grew up in a sort of displaced bubble, wanting to be, always associating myself as an American, but tied to Russian roots. Well, it's really interesting because in the Foreign Service, I find my role to be kind of 3 or 4 different sort of positions, and some of them are roles I would have never expected, or if someone told me this is what you would do, I would say like, wow, I don't know if I'm qualified to do that. But once you're in, you realize that you have to wear a lot of hats. So of course, patient care is primarily, and most of it's family practice primary care, so that's one aspect of it, and I enjoy that because you get to know your patients intimately. Then you're supervising the health unit, which is very different than what I did before. And that's an interesting leadership role and an opportunity which you grow into, because they don't train us to be in that position when you first go through a nurse practitioner program. But you work with a nurse or several nurses, you work with an admin assistant, someone who's making phone calls and scheduling patients for you, perhaps a couple of local doctors or providers. So that's the second part of the job. So then the third part is diplomatic, which is very interesting because you're out going to places, meeting local providers, trying to decide, can I depend on this? Is this quality care? Is it good enough, or is it adequate, or does it meet our standards of care that I can refer you to get an x-ray there or to see this specialist, and how much of that can we, rely on as a local resource? And even sometimes, okay, it doesn't quite meet our standards of care, but we can gain something out of this relationships, and perhaps I can offer them something. Like, for example, in Africa, there was a women's health clinic where they averaged 15 births a day, and this was in a country that was a lot of poverty, and women come from miles away, walk in and deliver, very high risk, so oftentimes, it was tragic. They would have infant and maternal mortality rates were pretty high. So I worked with the main physician there, and we were able to provide training and bring in these mannequins so they can learn how to teach their residents high-risk deliveries before they got into that position. And I really do love the job. It's just, I have the autonomy I've always wanted, but I also have the support. We work great as a team with the doctors and the psychiatrists and everybody, and I have been able to grow in my position into more of a leadership role, which has also been something if you told me 10 years or 15 years ago, I would have said, that's not me, it's impossible. So, really, really great place to work.